Good afternoon, and thank you all for being here today. As you can see, Dr. Joe Cantor is with me. Today we're also joined by Stephanie Flood. She is the commander of the Disaster Medical Assistance Team that's been dispatched here to Louisiana from the Department of Health and Human Services to provide staffing support for Our Lady of the Lake Regional Medical Center. We also have Ebony Addison, who is a nurse practitioner at West Jefferson Medical Center. In fact, I think Stephanie and Ebony are both nurse practitioners. But Ebony works at the West Jefferson Medical Center, and she's been on the front lines, and she's going to share what her experiences have been. And then we also are joined today by Dr. John Bel Edwards. He is a professor of pediatrics and director of community outreach, testing, and vaccination at LSU's Health Science Center in Shreveport. For emerging viral threats. He's going to be able to share what he is seeing in North Louisiana. As you all know, on Monday we announced the temporary return of a statewide mask mandate aimed at curbing the spread of this devastating fourth surge of COVID. That order did go into effect on Wednesday. It goes through September 1st. And I want to thank those who've stepped to the plate, put their masks back on, and are being part of this team effort to slow the spread. I also want to thank the businesses who are doing their part because they want to protect their employees and their customers and their communities. And they also know that this is a targeted temporary mitigation measure that is specifically designed to keep our economy open. These press conferences, while I hope are informative, obviously they alone aren't going to slow the spread of COVID. Words have to be followed up with action. And really, that's where the people of Louisiana come in. We need everybody to do their part to mask up and go sleeves up. On Monday, we wanted to convey the severity of the current COVID situation in Louisiana, and it is severe. We are at the leading edge of the surge. Case growth per capita in Louisiana continues to be the highest in the country. We're the number one state. That's not a distinction we want to have. And quite frankly, it's not even close. The number two state is Florida. With a percent positivity on our test that continues to go up, meaning we have no reason to believe in our data that we've reached the peak or that we're coming down. Case growth continues, hospitalizations continue, and of course, deaths as well. We have reached a critical point. Things, if anything, are worse today than they were on Monday. And I believe that that message has been received by the vast majority of the people of Louisiana. If you read any newspaper, watch or listen to just about any national news program, and you're going to see reports from Louisiana, interviews with doctors, nurses, or families who are suffering. So unfortunately, the eyes of the nation are largely on the state of Louisiana right now. We have more children sick with COVID-19 than at any other time during the pandemic. And as we heard from hospital leaders on Monday, particularly Dr. Klein, the pediatrician from Children's Hospital in New Orleans, the Delta variant is affecting children at a greater rate than during the surges that we saw previously. For example, at Children's Hospital in New Orleans right now, I believe there are 13 children hospitalized with COVID-19, including 6 under the age of 2. 4 children are in intensive care, and they include a 3-month-old boy, a 23-month-old girl, an 8-year-old girl, and a 17-year-old boy. This disease is impacting children and adolescents across the full age spectrum. And of all of the patients in the hospital there over the age of 12, and they were eligible for vaccination, none have been vaccinated. On Monday, I told you that 2,079 children had tested positive per that day's report. Since that press conference, in just 4 days, another 3,939 children, these are people below the age of 18, have tested positive in Louisiana. That means this week more than 6,000 children tested positive. So in light of that and the CDC recommendations, the recommendations of the American Academy of Pediatrics, the information that we've received here from the Office of Public Health and leading Louisiana pediatricians, and quite frankly, as a parent myself, I have to ask, why wouldn't we send our kids to school with a mask on? For their benefit and to slow transmission generally in the state of Louisiana. And we know better than to continue to believe that kids can't and don't get sick from COVID-19. And we certainly know better than to believe that they're not getting infected and that they're not infectious. And when they leave school, they go home to parents and grandparents and into the larger community. And any holistic effort to slow the spread of the virus, which is absolutely paramount right now, in light of all the things we're seeing across the state of Louisiana, simply has to include these young people. And that's especially true when you think about the fact that 0% of kids younger than 12 are vaccinated. Only about 13% of those between 12 and 18 years old are vaccinated. So all of the numbers that I'm about to give you are headed in the wrong direction. Percent positivity for a COVID test remains high and increasing. It's currently at 15.4%. The previous measure was 13.2%. Today, we're reporting 6,116 additional cases of COVID-19. We are also very sadly reporting 48 new deaths. That's more than 200 deaths this week that we've reported since Monday. We have 2,421 individuals in the hospital. That's a net increase of 71 since yesterday. We broke the all-time record that we've had in Louisiana on Tuesday, and each day since then we have gone up. And I can tell you the indications are we will go up by more than 100 more for tomorrow's report. 277 of those patients are on mechanical ventilators. That's an increase of 19 since yesterday. And it is because of these grim statistics, coupled with a shortage of nurses and hospital staff, that we asked the federal government to send medical strike teams our way. I am extremely appreciative and grateful for the assistance that we have received, and quite frankly, it is nowhere near enough, and we continue to ask for more assistance. And I will remind you, we had a nursing shortage in our state before the pandemic started, and certainly before this surge started. In fact, there are about 7,500 open positions for registered nurses, nurse practitioners, and vocational nurses across the state right now. And further exacerbating that is the fact that we have nurses and respiratory therapists and other healthcare professionals who themselves are out of commission right now as they attempt to recover from COVID-19 and get back to work. So while we appreciate the assistance we're receiving from the federal government, and we continue to ask for more, and we believe we will receive some additional assistance, it simply won't be enough. And that is why we have reinstated the mask mandate for indoor public spaces when social distancing is not achievable. And that's because we have to slow transmission. If we don't slow transmission, the cases will continue to grow, the hospitalizations will continue to grow, and so will the deaths. So we have 3 goals right now. And this is the point that we stressed in the Unified Command Group meeting this morning. They are to increase vaccinations, to slow transmission through proven mitigation measures such as universal masking, and surging our staffing capacity in Louisiana so that we can continue to deliver vital life-saving care to both COVID patients and non-COVID patients alike. I do have hope. I mean, I know we're going to get through this. How quickly we get through it, and how many people get sick between now and then, how many people die between now and then, is largely going to be up to us. But I do have hope, and one of the reasons is over the last month, those individuals choosing to be vaccinated, receiving their first shot of the vaccine, is up by more than 300%. Now, we start off in a very low level of vaccination, and so we have a long way to go. But I am heartened by the trajectory that we are currently on, and we have to continue that for some time. More than 2 million people now have received at least one dose of the COVID-19 vaccine. That's more than 43% of the people in our state. Only about 37.5% of our state is fully vaccinated, however. And sometimes it's helpful to compare ourselves or contrast ourselves with other states. We did have the second lowest percentage of the population vaccinated in the country for a while. Now we're basically tied with Arkansas, and there are 3 states behind us. I guess that indicates we're making progress here, but of course these other states are continuing to make progress. And are really rather focused not on comparing or contrasting with other states, but just doing everything that we can do here in Louisiana, because we have a lot more progress that we need to make. I, too, want to thank the employers in our state who've taken upon themselves to come up with creative ways to promote vaccination among their employees. Bollinger, for example, has launched their own lottery program based on what's happening in Louisiana now. I think people see just how transmissible and bad the Delta variant of the virus can be. So it's time that Louisiana shows them how we can fight back. And we know the tools that are at our disposal. Let's use them. Let's embrace them. Today, there are more than 1,400 locations in Louisiana where individuals can get their COVID vaccine. So I encourage you, do it. Do it today. This week, we actually had to order more vaccines than we've been ordering in the past because individuals are choosing to receive their vaccine. And I think Dr. Cantor pointed this out previously. Most of the people being vaccinated today have changed their mind. At some point in the recent past, they had decided to continue to wait, or maybe they had decided they weren't going to get vaccinated at all. And I welcome that. I would encourage everyone to understand that today is a new day. And no matter what you've said or no matter what you had decided before, in light of all the medical evidence of the safety and efficacy of the vaccines, in light of all of the evidence is just how serious and transmissible and deadly the Delta variant is, it is time to reevaluate and change your mind and talk to a medical professional if that's required in order to get all of your questions answered so that you can be comfortable making that decision. Is Nurse Carla here? Okay, so I introduce you all to Nurse Carla. Start coming up this way. Previously, that was back in June, she's a hospice nurse, and she lost her husband to COVID-19 last year. She then made it her personal mission to vaccinate as many people in her community as possible, including going door to door and having conversations with people who had decided that they were either going to wait, or maybe they wouldn't be vaccinated at all, or maybe they were just waiting for somebody to come up and explain to them what the situation is with the virus, the disease, and how safe and effective the vaccines are. Back then, she had vaccinated more than 1,000 people. She told you it was her goal to get to 2,000. Well, I'm happy to tell you she has surpassed her goal. She has vaccinated more than 2,000 people. So, Nurse Carla, I wanted to officially recognize you for your incredible dedication as a nurse and your commitment to doing all that you can to help combat this terrible virus. I honestly believe it's people like Nurse Carla, doctors, epidemiologists, and others working on the front lines who can best describe how urgent the situation is. And that's why we're going to hear from some of them in just a moment. But I did want to present to Nurse Carla an official statement that I'm going to give her from the state of Louisiana. And it says, I, John Bel Edwards, together with the citizens of this great state, do hereby give special recognition to Nurse Carla Brown in acknowledgement of her unyielding leadership, dedication, and commitment to personally educate and vaccinate more than 2,000 Louisiana citizens since March 15, 2020, after the loss of her husband to COVID-19, making her a true Louisiana hero, signed the 6th day of August, 2021. I'm going to give this to you. Thank you so much. God bless you.
Thank you.
God bless you. Okay, at this time, I'm going to ask Dr. Canner to come up. As I mentioned, he'll be followed by Stephanie Flood, Ebony Addison, and Dr. John Bancheri. If you've got questions for them, please ask them while they're up. I'll come up on the back side of their presentations and wrap up and then take a few questions of my own. Dr. Canner?
Good afternoon. Thank you, Governor. On behalf of Dr. Phillips and the Department of Health, we thank you again for your continued leadership in these most challenging times. And make no mistake, this is the most challenging time that we have had to date in this 18-month-odd pandemic. Also wanted to thank and welcome Commander Flood from the DMAT team, that we're so happy to have you and your team on the ground helping care for our patients. Ms. Addison and Dr. Bancheri, thank you so much. And Nurse Carly, congratulations again. You really are a remarkable inspiration of what one person can do. So thank you for what you've done. If you could go to the next slide, please. This is the same chart that we've shown many times now. And the bottom line up front here is that there's no real good news in here. We continue to set new records for the amount of COVID that circulates in our communities. And we continue to not yet see any tangible signs that we are turning a corner. And that, quite frankly, is terrifying. On the top left, you'll see COVID-like illness, which is the percent of ER visits across the state, which are attributable to people seeking care for symptoms suggestive of COVID, like cough, fever, and shortness of breath. It's now up to about 15% of all ER visits. That's an all-time high for Louisiana. On the top right, you'll see incidence, which is the number of new cases diagnosed day and day. That also is at an all-time high. We have gone up 952% over the past month. A couple other notable quantifications of our rise in incidence. We now have a 2-week incidence of 982 cases per 100,000 residents, pretty close to 1,000 per 100,000 residents. That means that over the past 2 weeks, about 1% of the entire state of Louisiana has become infected with COVID-19. Over the past 2 weeks, about 1% of the entire state has become infected with COVID-19 just in the past 2 weeks. And to parse this a different way, our daily incidence right now is about 92.5 cases per 100,000 residents, 92.5 or over 100,000. What the CDC considers to place you in the high transmission category, the highest of the 4 possible categories, is 100 cases per 100,000 residents per week. And we are just a tick short of that on a daily basis right now. As the governor mentioned, we continue to be for now about a week and a half or 2 weeks straight, the number one state in the country in new cases of COVID-19 per capita. On the bottom left-hand graph, you'll see testing volume in that purple line rise dramatically, as you would expect, given the amount of transmission that's happening and given the amount of exposure that is happening. And people are getting tested in high volumes after being told they were exposed. We should expect those increases to continue. We now have 15.4% positivity. That means of tests being conducted, about 15.4% are positive, as we shared last week. That's the largest number that we've had since April 22nd, 2020, the very first wave, when we had 5 times less testing volume happening, which artificially inflates your testing volume right now. And what gives us the most concern, again, is the number of COVID-positive patients that are hospitalized and now overwhelming hospitals across the state of Louisiana. Today we have 2,421 new patients currently in hospital beds being treated with COVID-19. That, again, is for the third or fourth day the highest number that we have had on record to date in this pandemic. Over the month of July, we have added 2,091 hospitalized COVID patients. That number that we added over the month of July is higher than the total number of any prior peak in our pandemic. We added just in the month of July. I'll tell you, as of today, 50 hospitals across the state have formally reached out to the Department of Health asking for help. These are 50 hospitals that have reached out to us telling the state that they can no longer adequately provide care for the amount of patients that need their services and they need help. That is a remarkable and unprecedented number. As the governor said, we are doing the best that we can to meet those needs and asking our federal partners for assistance as well. But there's not a magic supply of nurses and respiratory therapists and doctors in the country waiting to come here. 50 hospitals have reached out and said they do not believe they can adequately meet their community's needs with the amount of sick people coming into their doors right now. Over the past week, we have, through contact tracing, tracked 50 new outbreaks of COVID-19, accounting for 414 associated cases. 50 outbreaks is the largest number that we've had in a week to date throughout the entire pandemic. The most common settings that we have tracked outbreaks to include summer camps, daycares, bars, restaurants, and workplaces. Next slide, please. If you look at the number of new cases broken out by age group, we continue to see the largest transmission occurring in the youngest 2 age groups, individuals between the ages of 18 and 29, and the individuals below the age of 18. That's not a new trend. Individuals of that age are very effective spreaders of COVID-19, putting themselves and certainly those around them, their families, their coworkers, their colleagues and friends and students at risk. Next slide, please. You've heard a lot of accounts over the past couple weeks from physicians and hospital leaders speaking to the dramatic increase in kids who are sick in hospitals. And I know Dr. Van Cherry, who's a pediatrician and represents the Louisiana chapter of the American Academy of Pediatrics, will speak more to that. I wanted to illustrate what we're seeing just as a snapshot in time. If you look on the left bar graph, stacked bar chart, that is the age breakdown of the individuals who were admitted to hospitals in Louisiana on July 22nd, 2 weeks ago. And then the one on the right is the age breakout of the individuals who were admitted, new admits to hospitals in Louisiana yesterday. Not total hospital census, but people who were admitted to the hospital that day, new admits. 2 weeks ago, we had on that snapshot in time 2 pediatric patients, 2 children admitted. Yesterday, we had 7. 2 weeks ago, we had 12 individuals between 18 age and 29 admitted. Yesterday, we had 30. 2 weeks ago, we had 21 individuals between the ages of 30 and 39 admitted that day. Yesterday, we had 54, and so forth. what's more powerful than this chart is listening to folks like Dr. Klein, who joined us last week, like Dr. Van Cherry will share, I'm sure, who are treating patients, treating kids in hospitals, and Katie O'Neill, Dr. O'Neill, who was here last week too, and have been relaying to the public how shocked and disheartened they are to see so many sick kids coming in, and sick kids coming in number and severity that is unprecedented to date during this pandemic for Louisiana. The next slide. We continue, as the governor noted, to be the #1 state in the country for new cases, and the #2 state, Florida, is a decent whiles behind us, if you look at that number. I will say there's a number of states that are on our trajectory and have increases rather steep that may be 1 or 2 weeks behind us on that trajectory, but we remain #1. If you look across the country, there is an epicenter of COVID spreading emanating from Louisiana right now. We are the dead center of the national hotspot right now. I do believe this is going to spread to other states, and I do believe other states are going to be challenged by us, but very few will be as challenged as we are because they enjoy higher rates of vaccination, so they have more protection. Being amongst the lowest states in vaccination, we are amongst the most vulnerable, and that makes it abundantly clear. We are the epicenter of the national outbreak of Delta variant right now. I want to mention it one more time. 50 hospitals have reached out to us to tell us that they are stretched and they can no longer provide adequate care for all the patients that they are seeing and expect to come in through their doors. Truly, an unprecedented and remarkable number. I want to again ask people across Louisiana to take that into consideration before they go to seek care in an emergency department. Emergency departments are very busy, wait times are long, and hospitals are having to triage patients in the emergency department to the best of their ability. If you have minor symptoms, if all you need is a test, if you don't require acute care, I'd like to ask you again, please avoid the ER. Please seek those services at an urgent care or a pharmacy, if it's just a test or other testing availability. If you need help finding availability of COVID-19 testing, 211 is the best place to start. I'll also tell you that most large commercial pharmacies offer testing as well as over-the-counter tests. If you are sick, do not hesitate to go to the hospital. But if you have very minor symptoms or just need a test, please try and avoid the ER. We're trying to preserve the very limited capacity that ERs have right now for patients who truly do require their services. I also want to remind people that if you have been diagnosed with COVID-19 and you have not been hospitalized and you are early in your time course, you might be a candidate to receive monoclonal antibodies. Monoclonal antibodies are a therapeutic, a medicine that are designed to keep people with minor symptoms of COVID-19 from progressing to worse symptoms that might require hospitalization. This therapy is more effective the earlier that one receives it. So if one were to wait 5 or 6 days after their symptoms began, the therapy would be less effective. If one were to receive it within a day or two of becoming positive or having symptoms, it would be more effective. And again, the point of this medicine is to keep people who are not sick enough to be in the hospital from becoming sick enough to be in the hospital. If you do get diagnosed with COVID-19, I urge you to immediately contact your healthcare provider. Most hospitals in the state offer this medicine. It's typically given as an infusion through an IV that takes an hour, and then the hospital will monitor you for another hour for any side effects or reactions. You don't need to be admitted to the hospital. It's an outpatient procedure. Most hospitals in the state are offering this now. It really will reduce your chance of needing hospitalization, of getting sick, if you take it early enough in your course of illness. And it's an easy medicine to take. So again, if you do get diagnosed with COVID-19, and particularly if you are at increased risk by virtue of being over 65 years old or have underlying health conditions, immediately contact your healthcare provider. Ask them if you would be a candidate for monoclonal antibodies, And if so, what the best way to get them in your area is. Go to the next slide, please. As we've said a few weeks in a row now, as more and more cases are out there, as more and more COVID exists in the community, we can expect to see more breakthrough infections, more infections in people who already are fully vaccinated, because as we know, while these vaccines are excellent, they're not 100%. They provide excellent but not absolute protection. No vaccine is 100% effective, and you do see more breakthrough cases as the amount of COVID out there goes up. Amongst everyone who was diagnosed with COVID-19 in the past week, 90% were not fully vaccinated. Of everyone who is hospitalized today in hospitals throughout the state, 90% are not fully vaccinated. And of everyone who was reported as a COVID-19 fatality to the Department of Health last week, 84% were not fully vaccinated. I'll tell you, today we reported 48 new COVID-19 deaths, of which 45 of those 48 were not fully vaccinated. Go to the next slide, please. As the governor noted, we continue to see reassuring increases in the amount of Louisianans who are choosing to get vaccinated, and that really is heartening here. I think that's likely to shorten the duration of this spike. It certainly will help prevent against future spikes. Over the past month, we have increased the amount of people who began their vaccine series by about 500%, just shy of 500%. And yesterday, about 12,000 people got their first shot. Just like the governor said, those folks all changed their mind one way or the other, and that's great news. And I really encourage people to follow suit. I think if you talk to people who have not yet been vaccinated, they're scared. You look around, and in a small state like this, most people know someone who's positive or sick right now, and that's as good a reason as any to get vaccinated. And you can do so today. You can do so tomorrow. This is our fourth surge. It's our worst surge. Dr. O'Neill last week said these are the darkest days of the pandemic, and that has never been more true than today. We do have more tools at our disposal than we did the last couple of times around. We have vaccines available that are providing some protection to our community right now. I say some because our vaccination rates are relatively low. But this would be much worse for us right now had we not had 42% of our state initiate the vaccine series. We now have better therapeutics for COVID-19. We have the monoclonal antibodies that I just mentioned. And if you do get hospitalized, there are other medicines available to you, steroids and otherwise, that increase the chance that you are going to survive that hospitalization. None of these are silver bullets. They all provide slight, marginal benefit in the grand scheme of things. Not silver bullets, but they do help out. We also now, 17 or 18 months into this, have a much better understanding of how COVID-19 spreads. There is little, if any, debate right now that the predominant method of transmission is through the air. Individuals breathing, laughing, coughing, sneezing on each other. There is little, if any, debate right now that masking provides a simple and highly effective way at reducing community spread. Little, if any, debate on that after months and months of data throughout the course of this pandemic. If we are going to avoid more drastic measures in this state, the only way we are going to be successful in that is if individuals mask. And we need people's help with this. That's the only way we're going to be successful right now, is if people mask. And that holds true if you're a school kid, if you're a teacher, if you work in a workplace, and anyone else. That's the only way we're going to be successful right now. So I urge people to look around, take stock of what is happening in the state, take stock of the unprecedented challenges that hospitals face, realize that those challenges might be your challenges if you get sick and need hospital services, and those services might not be there in the fashion that you expect. And make the connection that the only way we get out of this right now is if more of our neighbors, friends, and community members choose to follow the governor's order and put on a mask. simple, safe, and it's really our best bet right now. I'm going to pause and be happy to take any questions if there are any. Yes, sir.
WBRZ just reported the breakthrough case data that the LDH provided. What message do you have to anyone reading that data, that report?
Number one, it's that vaccines work, and 9 out of 10 people on hospital beds right now are not fully vaccinated. Can you imagine what these numbers would be if we didn't have vaccines right now? So as the governor mentioned, and these stats were known last week when we said them too, if you are fully vaccinated, you have a 25 times reduction in your chance of being hospitalized, a 25-time reduction in your chance of dying from COVID-19, and an 8-time reduction in your chance of contracting simply COVID-19. Unfortunately, what we do know now with Delta, and this is why universal masking is so important, is if you break through that 8-time reduction in just contracting, if you become a breakthrough case of COVID-19, you likely have just as much virus in your body as someone who's infected and not vaccinated at all. I mean, you're likely to be just as easy to spread that virus, at least in the first couple of days, as someone who's not infected. That's a reality of Delta, and that's rather new from the prior strains. And so it's more important than ever, even if you are fully vaccinated, to mask, because asymptomatic transmission is real. It happens, and it's helping to spread this pandemic right now. These vaccines are remarkably effective. 25-time reduction in your chance of dying. 25-time reduction in your chance of being hospitalized. Remarkably effective, and I would be terrified to think what our numbers would look like right now with this variant if we didn't have the vaccination coverage that we have. Yeah.
Dr. Cantor, could you help explain what other levers there are as far as our hospitals in being able to increase capacity?
Yeah. And I would encourage people to talk to hospitals too, because I guarantee you every hospital is meeting likely on a daily basis right now to talk through. Nearly every hospital has now canceled elective or non-emergent procedures. There's probably some further procedures that can be canceled. Staff that are attending to clinics, outpatient clinics, might need to be directed to inpatient care. Nursing ratios, meaning if you have one ICU nurse caring for 2 patients, that's a standard ICU ratio. Hospitals might need to ask that nurse to care for 3 patients or 4 patients. And then once additional staff arrives, you can increase the occupancy within the hospital. All of those are rather drastic measures. And I think that the thing that's difficult to communicate is they have real consequences. Sometimes difficult to quantify, but very real consequences. I was told of a patient a few days ago that was sitting in an ER with a facial abscess, an infection in their face that required surgical drainage. The 2 risks of delaying a drainage like that are, number one, that infection can eventually seed into the bloodstream and cause the patient to become septic, which is potentially a fatal condition. And number 2, that infection can swell to the point that it occludes the airway and chokes the patient, also a fatal complication. This was a smaller hospital that did not have the surgical expertise to provide that service. It took 4.5 days to get that patient into another hospital with the expertise to drain that abscess. 4.5 days. And the patient did well, thankfully well, but the next one might not. And I think you're going to hear more and more of those stories, and families are going to be shocked to find that when they need emergent care, and no one plans on that, they're going to be shocked to find that it's not going to be of the quality or the immediately availability of it that we have grown accustomed to in this country. And that really is scary. And to connect the dots directly, the only way that we get out of this immediately is by masking, because the more people that mask, the less transmission will occur, the less people will require to be hospitalized, and the more our hospitals can return to normal operations. And normal operations doesn't mean that administrators are just working less hours. Normal operations mean that the hospital can guarantee the highest level of care to people that need it. Yeah, Melinda.
Can you talk a little bit about the situation in nursing homes? It seems that we're seeing infections go up, and we're seeing new deaths there after we had sort of turned that around for a while.
Yeah, we
And-
are.
And can you talk about the vaccination rates?
Yeah,
as well?
of course. Yeah. The question was about nursing homes and what are we seeing right now. We are seeing increases. Compared to what the increases were during the 3 prior spikes, they're relatively small. They're highly significant if you're at that nursing home or you're that patient or family, but compared to the prior spikes, they're relatively small. I'll give you what the numbers are, Melinda. Last week we had 72. This is 2 weeks ago we had 72 new cases amongst nursing home residents. This past week we had 136. 2 weeks ago we had 3 deaths amongst nursing home residents. This past week we had 8 deaths. 2 weeks ago we had 166 new cases amongst nursing home staff, and this past week we had 246. So notable increases, still relatively small compared to what they were during the prior spikes. At this point in time, 86% of nursing home residents have completed or at least initiated their vaccine series, and for staff that number is up to 50%. Nowhere near where we would like it to be, but incremental increase from what it has been in weeks past. When a nursing home has an outbreak, they are required by federal law, by CMS guidelines right now, to institute a number of measures. Number one is population-based testing, so everyone either on that floor or their whole facility gets tested, staff included, and then there likely is temporary visitation restrictions that get triggered, all by federal rule right now. Yeah, last question, please.
Dr. Cantor, one of the doctors who wrote the crisis standards of care said earlier this week that he fears, given this current trajectory of our surge, that it's a real possibility that care will have to be rationed. Wondering how you're thinking about this idea that care perhaps might need to be rationed.
It's a dark place. It's a really dark place. It's definitely never happened, I think, in any of our lifetimes. I think care is being rationed on a small scale right now, and as you heard from some of the docs that were here last week, hospitals are having to make difficult decisions of what transfer to take in, and those are not easy decisions. To have that happen on a much larger scale would be just an incredibly dark place. And I'll tell you, the governor, everyone in the Department of Health is working day and night to try and avoid that from happening. Public can help too. And the greatest thing that people can do is simply mask up. I mean, there's a direct line between not wearing a mask, increase in cases, increase in hospitalizations, and then the real dystopian measures that you kind of allude to. Thank you. I think at this point, I'd like to ask Commander Flood, commander of the Disaster Medical Assistance Team that we have on the ground right now, to come up and share a little bit about what her team is offering. Thanks, Commander.
Good afternoon. My name is Stephanie Flood Thomas, and I am the commander for Florida 4 DMAT. We are out of the National Disaster Medical System, if you've happened to heard that term recently. Our job here is to backfill and basically help replace nursing staff that the hospitals are desperately needing right now, especially in the ICU area. Currently, our staff, we have a 34-person team, and we have backfilled and opened up 6 ICU beds. So we are helping to bring in more patients. I will tell you my background. I am a physician assistant, and I have been for 21 years. I spent 16 weeks in Texas. I will tell you in my lifetime, I have never seen patients that have so many drips running. So this is a very urgent situation right now. We have critically trained nurses in our ICU, but they're also having help from the staff, so we don't have the hurdles of having to do the electronic medical records and things like that. We have integrated very well. The hospital has been fantastic in helping to get us integrated into their system. They've been very welcoming, and this is my first DMAT commander mission. I have 14 years of DMAT behind me on another team, but considering this is my first mission, and with the high acuity of this, it has gone exceptionally well. We have, on our team, we have doctors, nurses, paramedics, respiratory therapists, PAs, and NPs. And our job is to come in and help in any way we can If they need us to go and float down to the emergency room, we're flexing wherever their critical needs are for that either day or night shift. Do y'all have any questions? Yes, sir.
It's my understanding that you all are reviewing these requests that have come in from the hospitals for staffing needs and whatnot. I'm wondering I don't know if that's your role specifically or someone else in your team, but I'm wondering what we can expect going forward as far as federal support, or, I mean, even how realistic it is that the feds will be able to provide as much support as been asked.
The only thing I know at this time is we did have a team out in the field, and they have collected the data. They have went back to DC, and they are reviewing the data and the needs of the state right now. Other than that, I don't have any further information. I could defer to Peter if he had any further. Okay, we'll answer that after. Okay. Next question, please. Yes.
Can you talk a little bit about what you have seen in Louisiana versus some of the previous places you've been, if it seems equivalent to when you were in Texas, or kind of what the comparison looks like?
Okay, so basically the question is there any difference where we're at here in Louisiana compared to other states that other or responders have been in? I know our team has been in multiple places. I personally, like I said, was in Texas. I would say the severity at this point is worse, other than at the initial onset of the COVID-19 outbreak, where we didn't know what we were doing. We were basically all looking for what is going to be the best treatment. I would say, however, since we have a lot of good treatments, or I wouldn't say good treatments, but we have some treatments that are helping, I still think this is a very bad situation. I think the patients are very sick. And like I said, in my entire career, I've been in medicine for over 30 years. I've never seen a patient on so many drips in my life, and that is multiple patients currently in Our Lady of the Lake Hospital. Yes, sir.
Could you talk more about how you treat patients? Either, like, do you treat them specially, or any special medicines other than steroids and maybe these monoclonal fusions?
Okay. As far as the current treatment, I would defer to our medical director, Dr. O'Neill. That would be a question for her. I do not know what the current treatment protocols. As the team commander, I'm not in that hat, if you will, at this time. Any other questions? Okay. Other than that, I would just suggest please go out. If you know someone who needs a vaccine, please help them get there. If you know someone with a mild illness, try to get them over to a monoclonal antibody treatment facility to get those on board. I did clinically see those help in patients when I was in San Antonio. Just stay safe, keep your mask on, stay 6 feet away, wash your hands, and get your vaccine if you can. Now, the other thing I would say is if you are concerned about the vaccine, if there's one particular reason you have seen something on Facebook, don't read Facebook. Please call your provider, make an appointment, go talk about your real issues, and have them give you the data, the facts, not the memes that are going around Facebook. Any other questions? All right. Thank you guys very much.
Hi, everyone. First, I want to thank Governor Edwards for inviting me to represent the efforts of our team at West Jefferson Medical Center and LCMC hospitals as we continue to battle COVID-19. I would also like to thank Dr. Cantor as well for continuing to do all that you do as a state leader in health, as well as part of our LCMC family. As previously mentioned, I am a nurse practitioner at West Jefferson Medical Center. I primarily take care of stroke patients. But when COVID-19 originally began to affect our community, I was in a sort of a transition from a bedside stroke nurse to a nurse practitioner. And with everything that was going on and affecting our community, kind of that process was on hold. And with the rising number of COVID cases in our area, our stroke unit was converted into a COVID unit. And so I assisted the manager of that unit in running the day-to-day on that unit. And so I firsthand was able to see how the virus had affected our community, how it affected our staff, our day-to-day function, what it looked like to come in and treat those patients. I also witnessed firsthand what it was like to be there with those patients, unable to see family, to deal with such a condition, to watch them sometimes more often than not on their last days, on their last breath, trying to offer them as much comfort, as much kindness as we could as we adapted on the day-to-day to what we were being challenged with. And so this went on for months, and as we approached the end of the year, graciously, we were presented with the vaccine. And so, of course, myself and my colleagues were one of the first providers that were offered the vaccine, and of course, we graciously accepted. We rolled up our sleeves, we took our vaccines, and we continued to take care of our patients. Fortunately, for a period of time, we were able to see some of those more traditional illnesses that we were used to seeing, treating our cardiology patients, our stroke patients, trauma, illness, but of course, still our COVID patients as well. And so with the vaccine becoming even more available and available to our community and our general population, our health system was able to provide a mass vaccination site, of course, at the New Orleans Convention Center. And so that gave us some hope and helped to motivate us to continue to provide care for our community and hopefully to ease up some of the stress that was being put upon our health system. And of course, we know that all came at a cost. The burden that all of our frontline workers were put to face to give everything they had every day wholeheartedly as a system, as an organization, to treat our community, to do everything we could to give them the best care we had available at that time. And so, unfortunately, we find ourselves at an even tougher battle now with this variant that is affecting our community. And unfortunately, we're seeing a lot of patients who are needlessly ill, that they're getting sick. And often I hear, I wish I would have gotten the vaccine, or, I thought about it, but it's just so new, or I'm young and I don't have any underlying conditions. I don't really need this vaccine. And while we hear you and we're listening, what we're seeing in our community does not meet that theory. People are continuing to get sick, and now, as the governor mentioned, our children are sick. They're greatly ill, and I can't help but to feel as though those could have been prevented. If our community, our people who are able to get the vaccine will, just go a step forward, take that step, and get the shot. And so I do stand with our healthcare leaders and our frontline workers and continue to advocate for the vaccine and encourage anyone who has any questions to reach out to the professionals, to read the data when you have concerns about the vaccine, and continue to wear our masks and wash our hands, practice social distancing, all those things that have helped us in the past. We need all of those things now together so we can continue to do the best we can for our community. The healthcare staff, we're depending on our community to help us. And so I thank you all for listening, and Governor Edwards and Dr. Cantor. Any questions?
There was a poll on unvaccinated people by the Kaiser Foundation on Wednesday, and more than half of the people who are unvaccinated, including 75% of the people who say they're definitely not getting the vaccine, think that getting the vaccine is a bigger risk to their health than getting infected with the virus. So just to be clear to those people, if any of them are listening, to hear it from you, a medical professional working in that hospital, how many people are in the hospital because they've gotten the vaccine versus because they've gotten the virus? And do you have a message for those people?
I don't have any specific numbers to speak to that part of your question, but as far as to clear up any questions as far as the vaccine and what it does, I see that we are at a battle. We are battling a pandemic that is affecting our community. And this vaccine is our armor. And going out into the field with armor is better than nothing. And so we have data that proves that this vaccine is effective, that it does help and it will help more the more our community participates in taking advantage of it. Thank you.
Good afternoon. I'm Dr. John Bel Edwards. I'm a pediatric infectious disease specialist on the faculty at LSU Medical School in Shreveport. I'm a second-generation Louisiana pediatrician. My mother's a nurse in Southwest Louisiana. But first, I'm a parent and strive to be a man of God. So I represent now the teams that work for me in Northwest Louisiana, providing vaccines and testing in our community, in our nursing homes, and many of those are nurses, paramedics, EMTs, and other support staff helping make our work successful in saving lives. My different team is working with me on a daily basis on clinical trials to understand the effectiveness of the vaccines, to get vaccines approved for our children less than age 12 as quickly as we can and as safely as we can. So my first message is really to parents in the state of Louisiana. I know that there is a lot of concern about our children going back to school wearing masks. Right now, as Dr. Cantor has said, as the governor has said, masks are the only thing that will change the course of this surge right now. Masks save lives. There is no doubt about that. They absolutely do. For parents who are concerned about their children having to wear a mask at school, you have alternatives. You can use virtual school for your children, or you can homeschool your children. But it is not safe for anyone right now in the state of Louisiana to be in a public space with non-vaccinated people without a mask on. And most importantly, our children under age 12, our school-age children, are not eligible for vaccines. They are at great risk now. This is a different pandemic than we dealt with a year ago. Let me be clear, this is a very different pandemic than we dealt with a year ago. More than 20% of new infections are occurring in children. And you've heard about the children who are in our hospitals now. They're not great numbers of children, but they are our children. We know that annually, influenza virus kills about 200 children in the United States. The COVID virus has already killed over 400 children in the United States. And while the statistics will tell you that's a 1 out of 100,000 risk that your child will die of COVID, for those 400 plus families, it's 100%. Make no bones about it. Those families are struggling now on a day-to-day basis. Children in Louisiana have died of COVID, and more, unfortunately, will die. This is not a time for politics, for fighting and threatening lawsuits about having to wear a mask. Masks save lives. And if you're a pro-life Louisiana citizen like I am, wear your mask. It's very, very simple. Dr. Cantor has talked about how our health system is stretched and 50 hospitals have asked for assistance. I can tell you I work every day with nurses and EMTs and paramedics and respiratory therapists who are stressed. They're working long hours. They're working many overtime hours, many more than they would like to work. But our vocation as healthcare providers is to save lives. There is nothing greater than that. And that's why we do what we do. That's why we are on the front lines every day. That's why we go back to work each day, to save lives. Folks who are coming for vaccines up in Northwest Louisiana are coming now tenfold more than they were a month ago. That's very good. That's very good. As the governor said, those are people who were hesitant, who waited, and have changed their minds. That's good. That will prevent the next surge from hitting us so hard so quickly. But right now, this surge can only be dampened by wearing a simple mask. And educators have asked me, how can you put faith in a mask? Because it works. The data is clear. I've been in the face of hundreds of people with COVID-19 wearing a mask just like this and not gotten COVID. Masks clearly work. Masks save lives. They prevent the transmission to other people, especially those who are more vulnerable. And I asked Dr. Cantor to put this slide back up, and he pointed out before the highest rates of new infections in those less than age 39, the 18 to 29 in the gray line, and the orange line up there right between those is less than 18 age group. And that right there is the number you should focus on as a parent. We're seeing more pediatric infections now than we have at any time in this pandemic. The great news is most of those are mild. Most of those are a nuisance. Many of them start as, I think my kid's having an allergy attack or something else. That's okay. But we know that kids now are infectious, and we know that they are continuing as part of an unvaccinated population to foster the spread of this pandemic. And the only way to change that is masks. And the other piece I wanted to point out, if you look at the lowest rate of new infections on this graph, the brownish color that's at the bottom here, that's the age group over 70. That's the population in our state that's nearly 90% vaccinated. That's amazing. That's a testament to how effective our vaccines are at saving lives, preventing hospitalizations, and hopefully slowing down this pandemic. We know now that the average age of hospitalized people in our state is 25 years younger than it was a year ago. In Northwest Louisiana, we have pregnant women in the hospital on ventilators or on lung bypass because they're so sick with COVID. We've had a baby in our hospital born with COVID to a mom who had minimal symptoms of COVID. The baby was born premature, most likely because of COVID. This is a different pandemic. It is not the time for threatening lawsuits. It is not the time to mince words about where we are and the situation we're in. And I laud the governor, our public health officials. They're working tirelessly. They don't need to be berated in social media. They don't need to be attacked. Our only goal is the safety of the citizens of Louisiana. That is paramount. We are a pro-life state. There is nothing more pro-life now than wearing a mask. So please, mask up, roll up your sleeves, get your vaccines. The last thing I'll tell you is that 25% of those who are coming out for vaccines in Northwest Louisiana are less than age 18. Our teenagers get it. They understand. They want vaccine even when their parents may not. They get it. So let's pay attention to the needs of our children. Put their safety first. Have them wear masks. It is absolutely the right thing to do at this point. So I'm happy to answer any questions that I can. Yes, sir.
With schools opening this week and next week, are you worried about a further increase, especially with these terrible numbers in children? Do you see schools closing even?
Right. The question is about the safety of opening schools and whether that presents a threat to, further fuel this surge we're in. I've talked with many of our educators, and they're working very hard to balance two things: the education of our children and the safety of our children. And those are the top two priorities. We were very, very successful last year at having our kids in school very safely. and keeping them at least not from falling as far behind as many, many millions of kids across the country have. So my reality is that, yes, there will be some bumps in the road. There will be some schools that may have to close. But the mitigation strategies that we have, simple as they are very effective at keeping our kids safe. And our kids need that education. They need that consistency. School is the best place for them right now. Thank you, Governor.
Thank you, Stephanie, and your team for coming to Louisiana and helping out here in the Baton Rouge area at Our Lady of the Lake. Thank you, Ebony, for your work over the last 18 months and that of all of your colleagues and healthcare professionals everywhere around our state. And then, you know, I'm tempted to, as a lawyer, to close on the information that was imparted by Dr. John Bel Edwards, because I think it was extremely powerful, and there's just not a better way to convey just how serious this situation is and how necessary it is that we vaccinate, that we mask, and that we do everything that we can for our children so that they can safely return to school. But I can't. There's a few things that I have to say. I want to get back to Melinda's questions about nursing homes. And I really think this speaks to the efficacy of the vaccines more than anything else. There are many more nursing home residents who are getting, by the way, we don't have nearly as many who are getting COVID as we had in previous surges. But many of those who do have mild cases. They don't have to leave the nursing home. And in a call that we had earlier this week with all of the Tier 1 hospital medical directors across the state of Louisiana, a number of them commented on how much better this is from that perspective, because in previous surges, especially the first one in March and April of last year in May, nursing home residents were flooding the hospitals. If you superimpose that on top of what we're currently seeing in our hospitals, it would be that much worse. And so we're very thankful that 85% of our nursing home residents have been vaccinated. That means they're less likely to contract the virus, and if they do, they are much, much less likely to need to go to the hospital, and that is helping a lot. There was another question about the safety of vaccines relative to the number of people who are actually in hospital with COVID. This is a little bit from memory, so I want Dr. Cantor to check me on this. But to date in Louisiana, there have been about 2,050,000 shots administered. Actually more shots than that, but that's how many people have received at least one shot. 8 serious reactions. Serious being defined as needing to stay in the hospital overnight or death. 8? And 0 of them have been deaths. So when you want to try to figure out which poses the greatest threat to your public health, to your health as an individual or to your family, think about that. Think about the people that have been in the hospital and dying from COVID, and the fact that we have had 8 serious reactions, all of them requiring short-term hospitalizations, and none of them resulting in death. I want to take a moment and congratulate our latest shot at 1 million winners. So congratulations to Cody Hemperly of Shreveport. He won $100,000 cash prize. I also want to thank him because he works in one of the state's largest health systems, and he helps patients who need assistance covering the cost of their care to find ways to pay for their care. So I had a great conversation with Cody yesterday, and congratulations to you again, and thanks for choosing to be vaccinated. And our $100,000 scholarship winner is 13-year-old Nevada Charity of New Orleans, and she is headed to the 9th grade. English is her favorite subject. She doesn't know where she wants to go to college yet, but she knows she's going to college, and she and her family are super excited about that $100,000 scholarship. Next week, We will be announcing the remaining 5 $100,000 scholarship winners and the grand prize winner of $1 million in cash. And we'll be making that announcement 1 week from today. If you have questions about the vaccine or you want to schedule an appointment, please call 211, or you can call our COVID hotline at 1-855-453-0774. You can also visit vaccines.gov. We have had a recent increase, obviously, in people calling to schedule appointments, and that should be encouraging to all of us. You can also get your answers questioned. Your questions answered by medical professionals. And to help in this as well, LDH will be holding regional telephone town halls with medical professionals across the state over the next week. So please keep a lookout for a call inviting you to join, and that call will come from Dr. Cantor. Finally, and importantly, next week I will personally observe 3 days of prayer and lunch fasting on Monday, Tuesday, and Wednesday for like-minded individuals who, like me, believe in the awesome power of prayer. I'm asking that you do this as well. Again, that's Monday, Tuesday, and Wednesday, and that we will lift up our state in prayer, especially those struggling with COVID, those who've lost family members and friends to COVID, and those healthcare professionals who are working so hard and are so exhausted. So at this time, and I'm mindful we've already been here for 1 hour and 12 minutes, but I am going to take a few questions if you have them. Yes, ma'am.
Governor, the Attorney General has put out an opinion today that seems to suggest that he does not believe you have any legal authority to require masking in schools. Would you like to comment on that?
Yeah,
opinion?
I think he's completely wrong, and the reasoning is I think very poor. The fact of the matter is, I have the authority and the obligation under the current circumstances to declare public health emergencies. We've done that for the entire state of Louisiana. And the mitigation measures that I have ordered for our state apply in our schools. Not only in our schools, but they apply in our schools just like they apply in other public indoor spaces. And simply put, because I'm not differentiating between what we're doing in schools and elsewhere, it is clearly within my authority. And the analogy that I will give you is if we had a hurricane approaching and I ordered an evacuation from coastal parishes, it's not like that order of evacuation wouldn't apply to the schools in those coastal parishes. So I think the Attorney General is just completely wrong. And not only is he wrong, he's going out of his way to undermine public confidence in the basic mitigation measures that will slow transmission at a time when we need it more than at any other time in this pandemic. It is sad. It's regrettable. It's also irresponsible, and it is dangerous. Anything else? Yes, sir.
A number of hospitals are starting to mandate vaccines or saying that they will. Do you have any worries that that will affect staffing further with people quitting? Hopefully that doesn't happen, but do you have any worries?
No, I don't worry about that. I think that those decisions are left to the sound discretion of the administrators of those hospitals. And my understanding is the time horizon that they're giving people to be vaccinated is such that we're very, very likely to have full FDA licensure or authorization of these vaccines within the next few weeks. They have longer than that to be vaccinated, and I happen to believe that what those hospitals are doing is the correct thing for the employees and their families, but also for those patients. The number one thing you do in the medical profession is you first do no harm, right? Yes.
As Dr. Cantor said, there's no sort of end in sight here at this point. The peak, not sure when it's going to happen. I mean, from your perspective, how close are we to having to implement new mitigation measures of any kind?
Well, right now, we're not contemplating any additional mitigation measures, but we are working very hard to get compliance with the ones that we have in effect. I believe, and this is consistent with CDC recommendations, that public indoor masking is sufficient to curb transmission, to actually bend the curve and get the growth in cases coming back down so we can give some breathing room to our hospitals. And so right now, we're focused on getting more compliance with that, getting more people vaccinated, because we know that those are the two most powerful tools we have at the moment. And it's critically important that as many people as possible will be vaccinated and will honor this mask mandate and wear their masks. And I can't say it any better than Dr. Vancheri did. Yes, sir.
There's breaking news that the FDA is rushing to authorize extra doses of the coronavirus vaccines for Americans with weakened immune systems. Do you have any insight on timing from the White House as to when that will happen?
No, and you just said it was breaking news, so it's a little unfair to ask me what our plan is. But what I understand is that sometime, and maybe this is different than what I saw in the news last night, that we expect that over the next few weeks, the federal government, the FDA, the CDC will come up with a plan for how to do that. That plan will run in concert with communications with us, and we'll certainly be ready if and when it's time to pull the trigger. I will tell you that in a phone call the other day, Dr. Fauci mentioned to me that it's much more likely that a third shot, or a booster, if you will, would be given to someone who's immunocompromised as opposed to just someone who might think that they need a third shot. And so we'll be looking at that. The good news is the vaccine supply is sufficient to do that. We now have a lot of history in terms of how to get people connected with a provider who can administer the vaccine, and we do it across a variety of settings every single day. And so when that time comes, I can assure the people of Louisiana there will be multiple very convenient ways for them to get that shot here. And that will be the case for anyone else who might later be authorized a booster shot, should that happen as well. Look, these are very difficult days for our state. There's not another state in the country that has the disease burden that we have. There's not another state in the country whose hospitals and healthcare professionals are challenged the way that ours are right now. And I'm appealing to everyone. Regardless of what your position on any of these issues were when you got up out of bed this morning, today is a new day. Consider what you have been told here by these healthcare professionals. Look at the reliable scientific information that is available on reputable websites. Take stock of this situation and what's best for you and your family and your community. What's going to help us to get past this surge as soon as possible so that fewer people become ill, fewer people are admitted to the hospital, fewer people die. If you will do that, and if you need help doing that, talk to a doctor. Talk to your doctor. But if you will do that and make the decision, the right decision, the correct decision to be vaccinated and to wear your mask, we're all going to be the better for it. And I want to thank those who are doing the right thing out there today. And again, I would ask everyone to continue to lift up our state in prayer and join me on Monday, Tuesday, and Wednesday of next week for lunch, fasting, and prayer. Thank you. Have the very best weekend you can have, and please be safe. And thank you very much. That's a long time to stand up here doing.